Welcome back to Bloom. There's an innovative clinic with a unique approach to healthcare focusing on patient empowerment. Joining us now with more on the holistic approach are Dr. Lana Gardner and Dr. Leah Teakle-Taylor from Docs Outside the Box and Kids Outside the Box. It is always a pleasure to see you both.
Good to see you.
Yeah.
So your way of treating patients holistically by combining Eastern and Western medicine is really growing. I mean, you guys are expanding, you're hiring. I mean, people want this kind of care.
Absolutely, they do. Recently, we've hired 6 new nurse practitioners. So for us, that means a lot more education. The structure of our clinic is based on education. So every day we start the morning with something called morning report, and the providers come to class in the evening.
Really? So does that mean that the patients that you see, that you're able to spend more time with them, and then you're also teaching these providers alternative care methods?
That's exactly what we do. So we do spend more time with patients, and then with the providers, they come, they're expected to keep up with Western education, but then at the same time, they're learning alternative education through us.
Which I think education is really so vital, because sometimes doctors just know what they were taught in the beginning, and that's where the book closes. So tell me more about the morning report.
Well, Gail, it's where we all get together early in the morning, about 7:45, with all the providers, and we go through every patient coming into the clinic that day. We go over all their findings, their labs, their imaging, and together we come up with the treatment plan. That way everyone knows what we've told the other providers, and everyone can learn, and every patient can get the benefit of our experience.
And I understand that you actually teach classes in the evenings as well.
We do.
Oh, yes, we do. Every Tuesday evening we have a didactic lecture period. We get lectures from other providers, from pharmacists, from representatives of the supplement companies we use, but we like to teach our extenders the details of the fine art of physical exam. We teach them not only what they have learned in nursing school, but also influences from Japan, China, India, and Europe. There's so much you can learn from just touching the patient.
Yeah, so talk to me about how you combine Eastern medicine and Western medicine. It's very forward thinking.
It is very forward thinking. I think what makes us special is we use Western medicine. It helps everyone feel safe, and then we will offer the alternative, but fundamentally the patient chooses the direction they want to go.
And I think by this group approach of actually going through each patient with a fine-tooth comb, this helps your patients not fall through the cracks, because I think that's the complaint of so many people is, I just feel like a number in the system, but that's not the case at Docs Outside the Box and Kids Outside the Box.
Never. We've always heard their name. We always know what their issue was when they came, and that way everyone can pitch into the help of the patient.
And you actually see results, and the patient empowerment must mean everything.
It means everything. We are adults. We should be able to choose the direction we want for our health care.
And then that way, if you need to pivot, you can pivot.
Exactly.
All right, ladies, as always, it is such a pleasure to see you both.
Thank you.
Thank you.
And Docs Outside the Box and Kids Outside the Box are located in St. Petersburg. For more information, just pick up the phone right now, call 727-498-8898, or visit online at docsoutsidethebox.us. We'll be back with more Bloom right after